Well, early this morning, I had the opportunity for an extended interview with the governor. Take a look. Governor Walz, thank you so much for joining us. I know how busy you are. We really appreciate it.
Honored to do it. Tough week for everybody.
Governor, we're just coming off, our viewers have just seen a story about a protest yesterday outside of your own home. People upset about youth sports. This, I'm holding up the headline in the Star Tribune, which I'm sure you've seen, no beds anywhere. Your thoughts about this dichotomy here that we're seeing here in Minnesota and across the country?
Yeah, it's unfortunate. It feels pretty politicized. Certainly, I can understand the frustrations people feel, businesses, schools, disruption of life. That's all understandable. But as I said this week, as I stood with care providers, this is just what we have to do. These folks are on the front line. That story in the Star Tribune is absolutely correct. We knew this was coming, and the decisions and the mitigation we're taking is to try and ensure that we don't overwhelm them. So I just have been saying all along, I wish we could just kind of all pull together. I get it, that these are just terrible news every time we have to turn back the dial, but the real terrible news are those emergency rooms.
Well, your news conference that I went to on Thursday was frankly one of the most chilling news conferences I've ever been to. You had the CEOs of healthcare systems, Alina, they are down 800 healthcare workers. Caris Care, which is outstate Minnesota, greater Minnesota, down 1,200 workers. That was 72 hours ago, that news conference. Where are we, and what is going to happen tonight and this week when people go to hospitals? Are there enough health workers right now?
There are, but it's getting tight. We're going to report another 40 Minnesotans died, and this is, as I said, it's an unrelenting math. And you're right, that news conference, I wanted to be very clear. They were not there to support the measures that I took on dialing things back. I was there to support them, that this is the reality that we're telling them. And I just have to tell Minnesotans, my goal all along was to make sure if you needed the care that you had a bed and the people there to care for you. It's getting harder on the people to care for you because they are getting sick, not at the hospital, they're getting sick in the community.
Or can we expect that for the next week, realistically? Is it going to be this bad for this whole next week?
Yes.
It is.
Yes, and I take no joy in that, but it is the math and it's the momentum. Case positivities are followed 7 to 10 days later by hospitalizations, which are followed by ICU and deaths. And we're in that spiral right now.
All right. And you've said that all along, that you can tell, tragically, you can look ahead and say, oh my gosh, we're going to have this many deaths coming. When will you know if these latest mitigation factors are working? I mean, is it 2 weeks out?
That's about right, Esme. There's the incubation period, either 10 days to 14 days. It's not exact, obviously. And what we put this in for 2 of those periods that we should start to see some of those movements. Like I said all along, the biggest thing will be is if people just choose to do the masks and to stop, the gatherings, especially the small social gatherings in their homes. So we should start to see, we should move through this spike we're seeing right now. Over the next week to 10 days. And if we're starting to get the mitigations that went into effect last evening, and to be very honest with you, I think people, and we've seen this across the country, whether there are government mitigations or not, when people see the crisis on their doorstep, they start to change their behavior. And I think hopefully that's what we see.
We've taken a lot of questions on social media to ask for you. I'm going to start with one from our newsroom, from Sandra, our producer who lives in Independence. She wanted to know about the vaccine. When will Minnesota get it? What is your plan for distribution, and who's going to get it first?
Yeah, well, those are things that are still being worked out. As I've said all along, I think the federal government's response has not been good on COVID in general. It has been good on this part of it. And we have been working for months on the distribution, the supply chain. You're hearing about ultra cold storage. From the time this stuff is manufactured to the time it's in your arm, we've got to do that in about 72 hours, and it has to be stored at 94 below zero. That is a logistical nightmare, but we've been working on that for months. Our hope is that once there's the ethics behind this, most vulnerable frontline healthcare workers, I think with Pfizer's move, I do think it's possible that sometime in late December we start to see that, and then we start to roll it out.
Here in Minnesota, we could have the vaccine.
I think so. Yeah, I think so. And there'll be the decisions made on how that's done. I have to tell you, it was a little chilling to watch the interchange between the president and the governor of New York about some of the politics of vaccine distribution. We've had none of that here. We were one of the 5 states that was picked to pilot how to do this. And the CDC wrote their manual on how this would be done by Minnesota's experience and the things that we're doing. So I do expect that we would be there. And I expect that, again, we're going to have to do much to make sure as this rolls into the first quarter of next year and the second quarter, we've got to get out, close to 1 billion doses because it's a 2-shot regimen.
Right. But you're hoping the end of December to healthcare workers here in Minnesota.
That's our hope. We don't have control over that FDA process and all of that. But I think as far as, the timeline we're looking, what Pfizer's saying, that is our hope. And that's what's different this time. There's a bit of a light at the end.
So the FDA has also given emergency approval to the cocktail that the president got, that he helped him recover so much. Do we have that? Or is that here in Minnesota right now at our hospitals across the state?
I do believe in limited numbers, that we've had that, that each state was given a certain amount. The healthcare systems report what they have. I do believe that's there. And that's really good news because if we had these spikes like we're seeing now in March and April, that's the situation you saw in New York City. We're in a better position, but I just can't say enough to Minnesotans. We're losing an average of about 50 Minnesotans a day and 7,000 getting infected. This will relentlessly go on until we break the chain of transmission.
All right. Another question, this time from Brent, who wrote to me on Twitter. What are you going to do, Governor, for the hospitality industry? They can't survive.
Yeah, everything I can. And I will tell you this, that the state of Minnesota will do what we can. We have done as much as we can as a state, but we obviously can't deficit spend. This is why we've been saying since May, every other nation in the world provided relief to their businesses because it's a public health necessity. We need the federal government to move the relief bill. They need to move it now, and they need to focus it specifically on hospitality and individuals.
Can you waive their taxes, though? Should they have to pay taxes on virtually nothing?
I think those are all decisions that will be made. The one thing I'm hopeful for is it appears like the legislature, us, everyone else is aligned to try and get this help. There are certain things that we need to be able to do.
Okay, going back to that federal stimulus, I've heard you say this emphatically now for quite some time, saying even if the bill is not good enough, you're talking to Congress, vote for it. That sounds like a message to Democratic members of our delegation to accept a less than perfect bill or something less than they want. Is that the conversation you've had with them?
Well, I've been on their side of it. Yes, I've had conversations with them. And I can tell you the other day, Senator Klobuchar just came off a 15-hour day of meeting with Republican members. They're doing all they can. And just to be candid here, the bill that passed in May is the one I want. State and local governments need this money. But I'm telling you now, with this spike and what the moves we had to make on hospitality, I am willing to say, take what we can get now and let's come back for something more later. Because right now, my biggest concern are small businesses, hospitality industry, and individuals. I mean, we have got a nightmare of evictions, protections that run out. It's not even just the money. It's some of the protections. COVID is not going to end on December 31st, and they need to do that.
All right. Quickly, another thing that struck me in that news conference on Thursday, the first question you got, and I thought it was a little odd at first, and then I thought, no, this is the best question of the news conference. The reporter from the Pioneer Press said, my friend and his wife are fighting. My friend wants to bring 2 buddies over for Thanksgiving. I was stunned by how quickly the doctors got up and said no. They didn't equivocate. They said, no, you can't, your friend can't have his 2 buddies over. How can you reinforce that for people?
Yeah, this is the reality, that it wasn't the major super spreaders. It was the micro spreaders. And that is exactly how this is spreading. And it is just heartbreaking. Again, the enforcement piece, if someone asks, no, we're not going in someone's house. You talked about the people in front of my house. They're talking about tyranny and we're going to break up their Thanksgiving dinner. No, I'll tell you who can't have Thanksgiving. Healthcare providers who are overwhelmed and every one of them's on shift. So I'm asking folks, it is absolutely heartbreaking, but gathering with your neighbor to watch a football game or gathering with your extended family, and this is what we do in my family, but we can't. My 87-year-old mother had heart surgery. We isolated her. Our goal was to bring her up here and live with us for a while. We can't bring her. So she is alone. We're dropping groceries at the door. We have to, because otherwise what that front page story is going to go on day after day after day.
All right. How are you doing?
I'm well. Thank you for asking. I am in a position of, like others, if you have some privilege and you have a safe spot, you have the ability to work from home. That's not what so many have. That's not whether they're teachers, truck drivers, clerks. My family is well. As I said again, I'm hearing about youth sports from a 14-year-old who can't play on a team he just made. It was the biggest thing in his life, and now he can't do it for safety. And I've got a sophomore at the University of Minnesota who is missing, and she should have been at a game the other night in a packed stadium with her friends, enjoying the collegiate experience. She's not getting that, but that's what this is. And I ask Minnesotans, none of this is fair. None of it is enjoyable. But again, the relentless nature of this virus, this is like something we've never seen in 100 years, and we've got a little bit more of a fight to go.
Governor Tim Walz, thank you so much, and we look forward to the day when you won't have to have coronavirus press conferences several times a week.
Me too. Thank you, Esme. Stay safe and happy Thanksgiving, everyone.
You too, sir. And the Minnesota Department of Health reports the latest COVID-19 numbers at 11 a.m. each day. But as you just heard, the governor said they will be reporting another 40 deaths today.